Welcome to Life, Love, and Therapy. I am Jumi Olawale. This show is about learning tips, advice, and ideas about how to improve our lives and relationships from the viewpoint of a therapist. Well, I am so excited to have Abigail Hust today. If you don't know her, you don't know her because you were not at the women's conference. I had her come and speak at the conference in September, and she's a sex therapist, and she blew up the entire room. As you can all tell, I am super excited to have her, but I'm going to have her introduce herself to our audience.
Yes, thank you, Jumi. That was such a good introduction. So I'm Abigail Hust. I'm a clinical social worker and a sex therapist. I practice here in Grandview, Ohio, working with all kinds of different sexual functioning individuals and couples, do some trauma work and all of that. So that is my main focus. And I got into this work because people don't want to say that's what they want to talk about. And so we have a lot of misinformation that gets spread or no information. So I really want to do this work to help everyone have accessible, quality sexual health information to go live a life that's full of pleasure and joy and really full of healing too.
Thank you so much. The work you do is amazing. And I always say to people, like, Abigail is my favorite sex therapist. So I am very always happy to mention your name out there because you're doing amazing work. So I'm going to start by actually asking you some questions that people sent me in my inbox to ask you because I posted on Instagram, Ask a Sex Therapist. And I also posted it on my Facebook. I wasn't sure if I was going to get some hits, because it's a sensitive topic, but I did get a few hits and I told the people that I will be sure to ask you. So the first question says, is there a way single people can practice masturbation in a healthy way without the use of porn? I'm going to give you a little sort of background into this. Some of my followers and listeners are people of faith. So I just wanted to sort of put that out there. And I also have very liberal followers and things like that. But I am just guessing that from this person's question, when they use the word porn, maybe that's where it's coming from. But have at it.
Yeah, I love that question because it's such a beautiful question, right? We want to explore our own sexuality and we want to do that in a healthy way. So I want to start by saying that solo sexuality or masturbation is a healthy practice. And it definitely can be healthy. Where it gets sticky is often in how we feel about it. And so really being able to give yourself permission to know this is healthy and it is okay is a really great first step in that being a helpful, healthy practice for yourself. If you are not comfortable with the use of pornography, you definitely can masturbate to your own fantasies, thoughts, or other kind of images that come to mind. And there's nothing wrong with that. There's also, for those folks who are interested in pornography, that's more ethically produced or where they can know that the performers are safe and want to be there and are participating. There are some really great websites now that are advocates for the performers, so you can feel better about that consumption. So a great place to start is called Crash Pad. So I recommend that to folks who are interested in porn. But again, if you would like to masturbate without porn, your own imagination is the best tool and just thinking about those things. And I also let people know that what you masturbate to doesn't have to be reflective of the sex you want to have in real life. So sometimes we're uncomfortable with what we're fantasizing about or what we're thinking about while we're exploring our own sexuality. And that's okay. It's okay to fantasize about something that you don't want to do in real life or that isn't something you want to put into practice in your sex life.
That is a very interesting thing you said there about that there can be some playfulness around your sex life and your imaginations and your fantasies that are not necessarily what you would like to play out in real life. So what you're saying is you can take off sort of the boundaries around maybe certain things that you may want to do in real life and just allow your mind to just have a fun time.
Yeah, absolutely. And I think sometimes we get stuck in that, oh, that's against, what I would want to practice. But definitely let yourself go and lead with what feels good to your mind and for your body and really practice being present with yourself during that time rather than placing any kind of judgment on your thoughts or feelings.
I didn't even know there was some kind of more ethical type of porn, right? So this is my first time. I knew
Yeah.
getting you on here would be fantastic because I knew I was going to learn things. I did not know that that was a thing.
Yeah, and there's a lot of great websites out there. So even if you just were to look up ethical porn, there'll be a ton of information out there. And a lot of performers are now self-producing. That way they get the money for what they're doing. They control who they work with, things like that. So going through the people themselves tends to be the best practice as well.
All right. Well, I'm going to move to the next question.
Mhm.
What pelvic exercises can men do in the gym to increase stamina and prevent orgasming too soon?
Okay, that's a good question because there's a couple things to look at there. So, one, I want to challenge this idea of orgasming too soon because I think sometimes we have ideas that are based in false things like culture, movies, or maybe pornography of how long sex should last. So, if it's not a problem for you and it's not a problem for your partner, I wouldn't say that you're orgasming too soon. I would also say if it feels like it's a problem because then your sexual activity is ending, I would really encourage you to keep going even after you orgasm. Check in if your partner wants to keep going. Be willing to do other things. It doesn't have to be over just because there was an orgasm. You could, transition to some massage or to some cuddling or maybe kissing, things like that. I definitely want to put that out there that maybe too soon is just because of what you've seen depicted out there. And if it's not too soon for you or too soon for your partner, then it's not too soon. In terms of pelvic exercises, so I'm not a pelvic floor therapist, but I would recommend if you're having concerns with your pelvic floor, you do see a pelvic floor therapist. But I will say it's a muscle. So the more you use it, the more strength it's going to have. The more erections you have, the more erections you'll have, right? So that is a good practice to get into. And then also really connecting your breathing when you're exercising. Our core is also part of our pelvic floor. So making sure we're properly engaging our core and things like that. Another common pelvic floor myth is that it's all in like strengthening, but we also need to be able to properly relax our pelvic floor. So that's when a pelvic floor therapist might be helpful to make sure that you're engaging and relaxing appropriately.
Thank you. Talking about orgasming. Okay,
Yeah.
so here's a question for you. What if a woman is unable to orgasm through being penetrated?
It's so common, right? So I think the most recent statistic I have seen is that 80% of people with vaginas and vulvas do not orgasm with penetration alone. So that means,
Whoa.
yes. So they need some sort of other stimulation. And that can come in a lot of ways. That can be clitoral stimulation, nipple stimulation, even just kissing, things like that. We also know arousal patterns can be different for people. I like to say all of it counts as sex, but commonly it's labeled as foreplay, right? So how long you're spending on the kissing, caressing, touching to lead up to that to make sure that you are fully aroused before there's any kind of penetration. Also, orgasms are great, but that doesn't have to be the goal of sex, too. We can talk about being present in our body and feeling pleasure and communicating with our partner what feels good or what doesn't feel good and really make pleasure the goal. And then orgasms might happen or they might not. And this also goes into that other question of sex doesn't have to be over because one person had an orgasm. And I think in heterosexual couples, a lot of the time when the partner with the penis has an orgasm or ejaculates, then the activity is just over when maybe the woman or the person with the vulva or vagina was not there yet and would like to keep going. So I think checking in with our partners, like, do we want to keep going? What's feeling good? And really leading with that is a good place to start. Also, if you're comfortable with it, exploring your solo sexuality is a great way to see what you like. When it's just you and yourself, you can kind of explore what kind of pressure feels good, where you like to be touched, where you don't want to be touched, and then share that with your partner.
Thank you so much. Building a bridge from that, what about when men, especially in heterosexual relationships, where because their partner isn't orgasming, that they end up having some kind of anxiety around the fact that they're not, quote unquote, bringing their partner and that maybe they didn't do a good job. What would you say to a male partner who has a female partner?
Yeah, so to those male partners, first of all, I think being willing to talk about it is such an important step, and not hiding that you're feeling that way. Being able to say, I'm feeling a little insecure. What can I do differently? And really working with your partner to do those things that feel good for them, and really being willing to take the time to set the right mood and the right context for sexual activity, being willing to listen to some feedback and explore what feels good. And then also taking that step where if you have had an orgasm, then saying, are you done or should we keep going? What else can I do for you? And not taking it personally, right? Bodies function in all kinds of ways. So you can view that interaction as a way to connect and have that shared experience with your partner, and take away the pressure of orgasm being the goal. Like, did we both have a good time? Did we both feel connected and embodied during that experience?
Thank you so much. I'm going to move to the next question.
I love these questions.
So this person is asking, they're saying that they're married and they're not having sex. What can we do?
Yeah, so that's a big question, right? Because there's so many reasons why that might be the case for you. And so this is not always true. A common pattern I see in my office is people had more sex early in their relationship, and now they're not having sex as frequently. And so it's like, we want to get back to that. And so what I challenge people to do is instead we want to create a new relationship, because we're never going to get back to an old relationship. So how can we create a new relationship that allows more room for sex and pleasure? So a good starting point is to share with your partner how you're feeling, what you would like, and see if they're on the same page. Is this something they're missing too? And I really, really encourage people to not focus on frequency. There isn't a magic number of you should be having sex this many times a week. So it's the amount that feels right to you and your partner. So when you're talking about it, we don't want to say, okay, my goal is to have sex once a week. We want to say, my goal is to feel connected to you, feel more pleasure, self-define that goal. And then work around how can we create an environment that's more conducive to sex? Is it that we're never home at the same time, or someone goes to bed, 2 hours before the other person, or our kids are always around? So identifying what some of those barriers are, and then getting creative about how to work around them. So we have the blessing of technology now, so we can stay connected that way. Maybe sending some flirty text messages, building the suspense, or kind of setting the stage that way can be a good way to do that. There's a great resource called Come As You Are by Emily Nagoski that has great tools for exploring what feels good to you sexually, both in a sexual sense and what outside of sex do you need to be able to get in the mood. Like, do we have to make sure all the laundry's done before, we feel in the mood? So that's a great tool for people. But the very first step would be having those conversations, checking in, see what you're missing, and building back up to that. If you're not having any physical intimacy at all, maybe start with some hand holding and some open mouth kissing to kind of get back into that routine and build back up to that connection.
All right, here's the next question. My partner wants sex more often than I do. She gets frustrated. What can I do?
Yes. So that is true in all couples, that someone has a different level of desire than the other partner. We're just not going to be perfectly matched all the time. And so it's about how do we negotiate and have that conversation when it's coming up, because we can really quickly get into a cycle where we do it less and less because we want to avoid that confrontation of disappointing our partner or frustrating our partner, right? A really good first step is to talk about the reasons why you and your partner have sex. So sometimes we have sex to connect. Sometimes we have sex to feel pleasure. Sometimes it's for stress relief, right? There's all these reasons. So identify that reason. And then when you're coming to your partner, making that bid for sex or for connection, identify what that is. So maybe your partner just wants to feel close to you. So if you're not in the mood to have sex, you could say, but we can snuggle instead, or we can, do a massage instead. So that's one strategy. Another strategy that I love is what I call leaving room for the maybe. So sometimes we say no because we're not sure, and it's easier to say no than to kind of head down that road where then it's assumed you're going to have sex and then you feel like you can't back out, right? So to speak, even though of course you can withdraw consent at any time. But when I say leave room for maybe, that means saying to your partner, I'm not sure I'm in the mood, but maybe I could get there. Let's start doing some things and see how I feel. So I encourage the lower desire partner to be able to say that and to share what might help that context grow for them. And then we don't have a lot of tools for talking about sex. So I like to use a dinner analogy with people to make it a little bit easier, where every night you and your partner have dinner and you're not always hungry at the same time. You don't always want the same thing to eat, right? You're not always sure if you're going to go out or stay in, but you figure it out and everybody gets fed at the end of the day. So same thing. You might not always want to have sex at the same time or in the same way, but you can develop the tools to talk about it so everyone's needs are getting met at the end of the day.
Ooh, that's so good. Anything that has to do with food, I'm all for it.
Right.
It's so easy to understand. I know that some of my listeners are people from the African continent. Being Nigerian myself, nobody asked me this particular question. I think it's important that I ask it. So for a woman that maybe when she was younger, she experienced clitoral circumcision, what advice would you give her? So earlier you said some of the statistics says about 80% of women with a vagina and vulva do not experience vaginal climax. But a lot of women tend to have more clitoral orgasm. But if your clitoris has been cut when you were younger, how do you get that pleasure from having been circumcised?
Yeah, that's a great question. So some of that is exploring other what we call erogenous zones of your body. So figuring out what other parts of your body bring you pleasure. Nipples is a big one. People talk about ears and neck, but really any part of your body. So being willing to explore what other parts of your body feel good to be touched and in what ways is one strategy for that. There's also varying kinds of genital cutting for women. So some of the time it is just removing like the head of the clitoris, but we have clitoral tissue all through our vulva that kind of runs down the sides of the vaginal opening. So stimulating that area that has that same kind of tissue. So being willing to kind of explore the full area and see what areas might have pleasure in there. Can be helpful. Sometimes there's pain associated with the genital cutting too. So if there are areas that are painful for you, being able to articulate and share to your partner, like, hey, when you touch in this space, that really hurts or that's uncomfortable for me, because we can have some scar tissue buildup or things like that get in the way. So really getting familiar with your body and what places feel good to be touched and in what ways and what places are better left not touched.
Thank you so much for addressing that. All right, to the next question. I cheated on my spouse, so she does not want to have sex with me anymore. How can I help her feel comfortable?
Yeah, and that's another big question, because with affairs or infidelity, there's a lot to unpack there, right? With trust and reestablishing trust. And safety, we need to feel safe in order to experience sexual pleasure. And sometimes with affairs, we lose that sense of safety with our partner. I really recommend people get couples counseling to recover from affairs and infidelity. I think that can be a really helpful tool to have a place for safe, hard conversations that need to be had. I also encourage people to go slow. So it might feel good to do certain things, but not other things might be triggering of that affair for the partner who's been hurt. So going at their pace, seeing what feels good to them, and really working on reestablishing that sense of safety is that first step. But a lot of the times there's stuff both partners need to share and get off their chest to heal from that infidelity. So that's why I think the help of a couples counselor can be really helpful to unpack all of that, because there tends to be a lot there.
Thank you. That is definitely a question that shows up a lot in the therapy room. So here's the next question for you. Am I asexual? I don't feel aroused. I masturbate fine, but have no interest in having sex.
Yeah, that's such a good question. So there's such a wealth of sexual identities, right? And we tend to see them broken down both into what we're sexually attracted to and romantically attracted to. So if someone is masturbating and finding sexual pleasure that way, it could be that they're just a solo sexual person rather than asexual. Another part might mean that they just haven't explored the context with a partner that feels good sexually to them. So I would want to know more about what that history or desire looks like with partners. And if they have romantic attraction but not sexual attraction, because sometimes those things are separate. So maybe they, have this solo sexual piece but are looking for romantic partners, or maybe neither. And that would be totally, totally okay as well.
Okay. So here's another question for you.
Mm-hmm.
And this goes more into being a new mom and the fact that like the body changes once you start having children, and also your sex rhythm, the rhythm at which you and your partner, or frequency at which you and your partner have sex might change. So what would you say to a woman that's just had a baby and doesn't feel sexy anymore? Maybe because of her body, maybe because she feels like if she had a vaginal birth, maybe she feels like a vagina has stretched beyond maybe whatever she thinks, because I've heard this kind of stuff where it's like, well, I pushed that baby out. I pushed out a 7-pound baby, 10-pound baby. Maybe my vagina is no longer what it looked like and it doesn't feel good. Maybe they feel kind of funny about their bodies. What would you say to a woman that's experienced changes in her body from giving birth?
Yeah, and it's such, a common thing that stage of life brings sexual changes, both for, the birthing person and partners, because it is such a different role. So our bodies are going to change over time anyway. So this is a great way to practice like staying connected to your body and staying connected with what feels good to you. So things might be different. Like, if you're breastfeeding, maybe you no longer view your breasts as sexual and don't want them touched during sex anymore. So that needs to be communicated to a partner. Or maybe you are a little bit self-conscious about, the way that your vagina looks. And so you need to communicate that to a partner. Or maybe have sex in positions where they aren't getting a full view so you can feel more comfortable with your body in that way. But I really encourage women too to acknowledge this awesome thing that their body did and respect that their body did this really cool, powerful thing for them and enjoy that experience. Don't rush back in to anything you're not comfortable doing. We have this idea that 6 weeks is the norm for everybody when births are so, so different, individual to individual. So do not rush yourself back into anything that you're uncomfortable with. Use a lot of lube. I tell everybody to use more lube, but especially after birth. And then breastfeeding can mimic menopause. So vaginal dryness is really common for people who are breastfeeding. And then they wonder why their body's not responding. And then that feeds into what you're describing. So definitely being comfortable using lubricants is important. And then just really rediscovering your body. Okay, and now I have these new marks, or my body moves in a different way. So what feels good to me now?
Yeah. So I have another question for you that's relating to maybe having an STI or having an STD that may be difficult to communicate to future partners. So let's say you're single and you've had that diagnosis or something like that, and you now feel funny about your body. And how do you get into future relationships, and your idea of sex has really been impacted negatively as a result of that diagnosis? How do you have those kind of conversations with future partners? And how do you also see your body and enjoy sex after such a diagnosis?
So I will say too, I tell this to everybody, I think in our current medical, world and all the medical technology we have, really the stigma is the worst part about STIs now, or STDs. We have great medicine to help people to treat things. It's just combating that stigma that's really the difficult part. You do not owe anyone that disclosure until you're being sexual with them. So I think sometimes we feel like, okay, do I have to tell everyone on the first date? Do I need to put it in my Tinder profile, right? And that's not the case. Until you're being sexual, you don't have a duty to share that with someone. And for people out there who maybe don't have an STI or an STD and are receiving that information from partners, I really encourage the first thing that they say to be, thank you for sharing that with me. And thank you for being willing to disclose that to me. And then you guys can have that conversation about where do we go from here and how do we practice, safer sex in a way that's protecting both of us. And how do we view our body was another part of that question for you. And I think it's okay. It's normal. We get sick. We get the flu from being around other people, right? That happens. We get STIs or STDs. It doesn't mean that you're dirty or something's wrong with you. And you're being responsible by getting it treated and communicating that to other partners so you're not passing it along. So I think just normalizing that as part of being a sexual being and that's okay. And there's nothing wrong with you.
All right. So I have another question for you about being in a long-term relationship. And you were saying earlier about how things change from when you're at the beginning of your relationship and the type of sex that you might have had at the beginning might be different now. So what do you say to that couple who've been together for like 30 years or 40 years or even 50 years, or sometimes even 5, and they're feeling like, it's boring. It's not as fun as it used to be. There's nothing really exciting. How can they infuse their relationship with joy and excitement and fun again? How do you get to know somebody you've known forever sexually?
I love that. How do you get to know somebody you've known forever? So part of desire and sexual desire and wanting is in that mystery or that newness. So being able to create some novelty and newness is a great way. I think sometimes that scares people. They think they have to, get out the whips and the handcuffs, which is a great strategy if that's what they want to do, but that's not the only way to create newness. We tend to get in a pattern of sexual behavior over time where you're having sex in the same way, right? Like maybe you start kissing and then there's some touching and then there's penetration and then it's over, right? And it's the same couple positions, or, you could script it without your partner being there. So I encourage people to just mix that up a little bit. Try not to have sex the same way that they've always been having. And a great way to start doing that is to really practice being embodied. And what I mean by that is being present in your body in that moment. So checking in with your body and what it's asking for and what it wants, and then leading with that. So maybe there's a part of you that you're thinking like, I wish my partner would really touch me here or do this thing, and saying that and putting it out there and taking the initiative to do things that would feel good for your body is a great way. Because if we're leading with what our body's asking for, that's not going to be the same every day. And so we're not going to get into that rut of having sex the same way every time. And then also just reopening conversations about what feels good to you. A lot of the times once we find something that works, we like to keep doing it, right? Because that protects our ego. We're like, oh yes, I know if I do this thing, my partner will feel good. And over time that changes. And so checking in about, hey, what kind of touch or pressure feels good to you? What positions feel best to you? Is there something new we could try? And really just being on that journey of exploring together.
Yeah. All right. Well, I have 2 more questions for you. The next question is, what happens as a man or as a woman when you have gained weight and you are very conscious about your body, that you don't want to show it to your partner, and maybe it's even getting in the way of you having sex? What would you say to someone like that?
Yeah. So first of all bodies are good bodies, and we all are beautiful and deserve pleasure regardless of what our body looks like. And that can be a hard thing to hear and absorb because of all the messaging we get around the way bodies should look like. I would also venture a guess that your partners are still very interested and attracted to your body. And that's something that's holding you back, not your partners, even though we tend to be consumed with the way that our partners are viewing us. So I never want people to do anything that feels uncomfortable to them, but I also challenge people to, embrace who they are and be okay, leaving the lights on and taking their shirt off and those kinds of things, even if they are uncomfortable. But really just the work is in loving who you are and appreciating your body and being confident in that is the best thing. Easier said than done, but a lot of the time it's our own blockage, not the way our partners are viewing us.
Yes. And here is the last question for you, Abigail. Since what you do a lot of work around trauma. So what would you say to someone who's experienced sexual trauma, whether it's rape or maybe when they were younger or whatever time that they experienced that sexual assault or trauma, and it's impacting their ability to be present in, during sex or enjoying sex? What would you say to them?
Yes, that's another big question because the way that we process trauma is so different person to person, and how that could be presenting sexually is so different person to person. But the number one rule that I tell all my clients is don't have sex when you don't want to. So a lot of the time we try to push through, right? If I push through, it'll be okay, or then I can make my partner happy. But we sometimes re-traumatize ourselves by trying to do that push through part. Solo sexuality is another great way to explore where your limits are and what's comfortable, what is okay being touched or not touched. Sometimes certain positions can be really triggering after sexual trauma. So maybe those positions just need to be off limits for a while and communicating that to partners. Also being willing, like in that leave room for maybe, like we talked about earlier. So maybe starting down that road, and then when things get too much, being okay, stopping and moving on to something else is really important, because then that's going to teach your brain, okay, this is safe. This person is safe. This experience is safe. I am in control. So definitely being, in situations and with partners that are safe and comfortable is really important. And then recognizing that sex can be an awesome tool for healing sexual trauma too. There's a lot of power in getting to a place where you can own your sexuality and reclaim your pleasure. It just sometimes takes a little bit longer to get there.
Abigail, what can I say? Thank you so very much. I would like you to tell the audience where they can find you, how they can find you, where your Instagram, Twitter, any handle that you have, and anything that you have coming up.
Yeah, thank you so much for having me, Jumi. And thank you, everyone, for these awesome questions. I loved it so much. You guys can find me on Instagram and Facebook at Sex Positive Ohio, and I'm on Twitter under Ohio Sex Therapy. And then coming up, I have a sex after baby workshop that I do with a pelvic floor physical therapist. Our next one's in February, but we are doing it ongoing, so you can stay tuned for that. And then I also, for other social workers or clinicians out there, have an upcoming sex positive social work training at the end of February through Ohio State. So people can find that through there.
What about your website?
And my website is sexpositiveohio.com. And then I also practice at Rudy Counseling, which you can find through sexpositiveohio.com.
Thank you so much, Abigail. We really appreciate you coming on Life, Love, and Therapy. This was amazing. Thank you. See you all next time. That is it for this episode. Thank you for joining. If you're looking for ways to help this show, please leave a nice review and recommend this podcast to your friends. Also, don't forget to like me on Facebook at Jumi Olawale Therapy and Counseling, and follow me on Instagram at Jumi Olawale the Therapist. If you have any topics that you would like me to cover on this podcast, please reach out to me via Facebook or Instagram. And you can also send me an email to jumiolawale@gmail.com. This is your host, Jumi Olawale. Thank you for listening, and see you next time.